Differential case presentation on patient 3 done by Ashley. Patient scenario is a 40-year-old female. She's a successful businesswoman with a high-profile career. She's been married for 4 years and she does travel frequently. Patient background: she has a history of breast cancer. This was treated for several months with tamoxifen. Her stressful career, while high profile, does tend to cause a lot of stress on the patient. Her marriage does have intermittent hardships, also causes some stress on the patient. At this time, the patient presents with shortness of breath, chest pain, flank pain, and a fever. Otherwise, the 40-year-old female is found to be healthy. Potential diagnoses that were chosen for this case are pulmonary embolus, an anxiety attack, or a kidney infection, also known as pyelonephritis. Diagnosis changes. The original diagnoses that were chosen were metastatic breast cancer, a panic attack, and pneumonia. After further research on breast cancer, treatments such as tamoxifen have an increased risk for causing a PE. So that fit, and the PE diagnosis, the pulmonary embolus, fit all four symptoms the patient was presenting with. So that's why that diagnosis was changed. Panic attacks was switched to anxiety attack because a panic attack is more based on fear and doom, whereas an anxiety attack is more based on the stress induced with life and events. A kidney infection was also chosen over pneumonia because the kidney infection includes flank pain and could necessarily demonstrate the other symptoms the patient is experiencing, whereas pneumonia is not related to flank pain in 99% of cases. Pulmonary embolus is a blockage in the pulmonary arteries of the lungs caused by a deep vein thrombi, which is the blood clot. The deep veins are most often found in the legs. So what happens is a thrombi detaches from the deep vein in the legs or from other body parts into the lungs, and once it travels to the lungs, there's a blockage that occurs, and this blockage causes a decreased blood flow to the lungs, which impedes lung function. This impedance will show shortness of breath, chest pain, fever, cough, and tachycardia. Some less common symptoms would be flank pain, delirium, or loss of consciousness. An anxiety attack is an imbalance in homeostasis that's caused by a stress response. So the stress response causes a release of corticotropin releasing factor, This stimulates the corticotropin, in turn releases stress hormones such as epinephrine or glucocorticosteroids and other neurotransmitters. The amygdala is the modulator of fear and anxiety-induced stimuli, and this is where stressful triggers can stimulate a response, and this response is the autonomic hyperactivity stimulated in the brain, and this causes the physical symptoms of an anxiety attack, such as an increased heart rate, uncontrolled hot flashes, chest pain or discomfort, shortness of breath, muscle tension, or restlessness. The reason this one was chosen as a possible diagnosis is the uncontrolled hot flashes or the increased metabolism caused by the stress response could cause an increased temperature in the patient, and the muscle tension could account for the flank pain, while unlikely it is possible. Pyelonephritis, or the acute kidney infection, is a bacterial infection most commonly caused by gram-negative bacteria. The most common bacteria is E. coli. This causes an inflammation of the kidneys, which causes decreased function and issues with the body. The infection can come from the blood or from an ascending urinary tract infection that goes untreated. The symptoms of pyelonephritis are flank pain, fever, nausea and vomiting, or hematuria. So the nausea and vomiting could account for the chest pain and shortness of breath just by the exertion that is related to vomiting, or nausea, or just the feeling of both could cause the discomfort. The most likely diagnosis for this patient is the pulmonary embolus. So tamoxifen is known to increase the risk of pulmonary embolus within the first 2 years of after treatment. This patient is within a year or so of treatment, so she does fit that risk factor. She also is known, the breast cancer can metastasize, and this increases your risk of pulmonary embolus in general. Patient is known to frequently travel. This can also cause with the sedentary and the flights. So the patient is going to be diagnosed with a pulmonary embolus because she meets all the presenting symptoms. So she has the shortness of breath, the chest pain, and the fever, and while not common, flank pain can be considered a symptom of pulmonary embolus. A way to confirm this diagnosis would be with a D-dimer. This kind of blood test measures the substance that's released when the fibrin, protein, and blood clots dissolve. So if there's a high level of this substance, the patient is at risk for a PE. If they have an elevated D-dimer, oftentimes an ultrasound is performed on the deep veins to identify any clots. If the patient is still at risk or has a confirmation of some clots, a CT scan can be performed, and this is the imaging of blood vessels that shows any clots in lungs and legs, and this would show the actual PE. Treatment plan would be that the patient at this time wouldn't need a referral anywhere special. Oftentimes, primary care physicians can coordinate care and control pulmonary embolus risk factors. They oftentimes will receive an anticoagulant, which is a medication. Most common used medication would be warfarin, and this prevents blood clot growth and new formation. So oftentimes a patient will have a prothrombin PT-INR drawn about once a month, more often if needed, and from there the primary care physician can determine whether or not they're in therapeutic range and adjust dosing from that point. Thrombolytics are used in serious situations. They are able to dissolve large blood clots, and the reason this is only used in serious situations is just because of the risk of sudden bleeding, and obviously you don't want to make your patients bleed more than they have to, which could cause more harm. A vena cava filter is a filter that's placed into a large vein that actually filters out the blood and helps prevent the formation of blood clots. This is often used when blood thinners are not tolerated. A catheter-assisted blood clot removal can be used in emergency situations. It can be very invasive, but it's when a catheter is physically placed into the lung and removes the clots. So overall, this patient would fit the diagnosis of pulmonary embolus. With confirmation of diagnosis, using a blood test or imaging could then be treated accordingly and hopefully have no further issues. Thank you for listening.